What we committed this year is that we were going to use Dr. Ara Bayak's framework. And if you guys will remember, zero tolerance for waste, fraud, and abuse, clinical and programmatic standards, making meaningful data readily available, and driving competition based upon quality. Dr. Teno was sharing, they just know my dog. They don't have a clue that the lady walking around with the dog has literally shaped a lot of this hospice and palliative care field and has continued to do so.
We need better oversight and better transparency. We have the data now. Let's use it. In LA County, there's one hospice for every 38 deaths. The suspicious side of me thinks there's a lot of programs are purposely flying under the radar by staying small. And in that staying small, they're avoiding public reporting, and they're also avoiding, hopefully not being subject to any of these TPEs or these UPICs because, they're not going to go after me because I'm a small provider. Maybe 800 to 1,000 hospice programs are going to, be suspended and go on to be closed. Here's what I want CMS to do. I want to be able to write a prompt that says, I live in 02806, and I want a hospice that's 4 or 5 stars, that has a good score on HLBI, has an inpatient unit, and doesn't look like it's gaming the system. My perfect example is the burdensome transition 1. Think about that measure. That measure is discharge, hospitalization, readmission. Well, there's one thing that these fake hospices being run out of a burrito stand can't do, which is fake a hospitalization. So their 0 score is suspect. There's a hospice with 90% of the patients with dementia. That's a little suspicious, if you ask me. My concern is we're going to lose public trust. And I think some of that is already occurring right now. And when you have an oversupply of providers, you end up with reduced staffing, lower quality of care, unethical enrollment practices, and you end up with hospices that are going from focusing on patient needs to patient recruitment. I think that's the thing that if I think really saddens me is there are persons who are running hospices who think it's great to make a profit over not providing services. And that is really disheartening for me to see. I'm going to stake my bet. I think we're going to be around 45 to 4,600 hospices by the time that CMS gets through with looking at all these and sort of doing their work on suspending some of these hospices that are really ghost hospices. The problem is these hospices are submitting fake data.
I don't know that we acknowledge and thank and highlight our heroes enough, but you're one of mine.